Welcome. Today, we're diving into something really important: the huge health gaps facing two key groups right here in Australia. We're going to follow the data to see how two very different health realities can exist in the same country. So let's kick things off with a big question. The thing is, the data. It pretty clearly suggests the answer really depends on who you are and where you happen to live. The story these numbers tell is pretty complex, and it kind of blows up the whole idea of a single Aussie healthcare experience. All right, here's how we're going to break it down. First, we'll get into the stark reality the numbers show us for both Aboriginal and Torres Strait Islander peoples and for folks in rural and remote areas. Then, we'll dig into why these gaps exist. After that, we'll look at a framework for actually building solutions. And finally, we'll talk about the path forward. Okay, section 1. Let's decode the data. We're starting with the reality for Aboriginal and Torres Strait Islander peoples. And honestly, the stats here paint a really, really clear picture of the huge health challenges they face. I mean, just look at these numbers. It's a massive life expectancy gap. For First Nations men, we're talking 71.9 years compared to 80.6 for non-Indigenous men. And for women, it's pretty much the same story, 75.6 years versus 83.8. This isn't just a small difference, right? It's a huge gap in the most basic health measure there is. Let's put a number on that for men. It's an 8.8-year gap. Just think about that for a second. That is nearly a decade of life that one group of Aussie men can expect that another group just can't. It's a staggering difference, and it forces you to ask, why? And this gap goes way beyond just how long people live. It's a pattern we see across so many health issues. First Nations peoples face much higher rates of chronic diseases, like heart disease, and a way heavier burden when it comes to mental health. And tragically, this all leads to higher rates of preventable deaths, from suicide, from injuries, and even in infant mortality. Okay, let's switch gears to our second group, people living in rural and remote areas. This chart really shows the power of geography. Look at that. The daily smoking rate in remote areas is 20%. That's nearly 3 times higher than the 7% in major cities. And this isn't just about people making a choice. It's often a symptom of much bigger problems tied to where you live. So here's the key takeaway. How far you live from a major city is directly linked to worse health. It's right here. Men's suicide rates, more than double what they are in the cities. You're more likely to have diabetes, more likely to die from cancer. The overall mortality rate can be 1.5 times higher in the most remote places. The bottom line is, the further out you go, the bigger the health risks get. Okay, so those numbers are pretty stark, right? But here's the thing. They don't just happen in a vacuum. To really get it, we have to dig deeper. These aren't just stats on a page. They're the end result of really complex, tangled-up causes. And this right here is the absolute key. Our health isn't just shaped by hospitals and doctors. It's deeply, profoundly influenced by the world around us, our social and physical environments, every single day. Things we might not even consider health issues are often the real root cause of these problems. Let's make this real. This flow chart here shows how stress from life circumstances can lead straight to behaviors that hurt our health. Think about it. If you're dealing with constant stress, from not having enough money or from insecure housing, you might look for a way to cope. And for some, that's smoking. So it's not just a bad choice, is it? It's often a reaction to a really, really tough situation. And for both groups we're talking about, where you live has a huge impact. Being geographically isolated, well, that makes it so much harder to just see a doctor. Poor or crowded housing can let diseases spread like wildfire. And not being able to get affordable, fresh food, that makes eating healthy pretty much impossible. It's the same story with things like education and income. They are incredibly powerful when it comes to health. If you have less education, it can be harder to understand health information and what to do with it. And a lower income, well, that creates really direct barriers. It makes it hard to afford good food, pay for prescriptions, or even just get a ride to the doctor's office. Okay, so we've got a handle on the problem and what's causing it. Now let's talk about solutions. Because if the causes are baked into the system, the solutions have to be too. And the good news is there are some really clear principles that are guiding the work to make things fairer. A really powerful way to look at this is through the lens of social justice, which we can boil down to the PEAR principles. That's participation, equity, access, and rights. And listen, these aren't just fluffy, abstract ideas. They're a practical roadmap for actually getting things done. So let's break that down. What's participation all about? It means making sure the people who are most affected get a real say in what happens. A brilliant example of this is NACCHO. It's the national body for over 140 Aboriginal community-controlled health services. In these services, the local community actually elects the people in charge and decides how their clinics should be run. It's healthcare by the community for the community. Makes sense, right? Next up, equity. And this is a really important one. Equity doesn't mean giving everyone the exact same thing. It means giving people what they need to have a fair shot. The PBS copayment program is a great example. It lowers the cost of medicine for eligible First Nations people because it recognizes they face a higher burden of chronic disease. Or think about the Royal Flying Doctor Service, providing that lifeline of free care to rural areas, filling a massive gap. Then we have access. This is all about tearing down the walls that stop people from getting the care they need. And those walls can be things like cost or just pure distance. Breast Screen Australia tackles that distance problem head-on, sending mobile screening vans out to rural towns. And look at what the Fred Hollows Foundation does. They train local Aboriginal health workers to do eye screenings, bringing that care right to the community's doorstep. And finally, R for rights. This is about making fairness and non-discrimination a core part of the whole healthcare system. It's things like mandatory cultural safety training in hospitals, so First Nations patients are treated with the respect they deserve. And it's strategies to get more doctors out to rural areas, because everyone has a fundamental right to accessible healthcare no matter where they live. Wow. Okay, we've covered a ton of ground, haven't we? We've gone from the hard data to the reasons why to some of the solutions in action. So after all that, what are the big things to remember from this whole complex picture? Okay, 3 key things. First, these health gaps, they're not just stories. They are real, and the data proves it. Second, and this is so important, these gaps are not individual failings. They are systemic. They're rooted in the conditions people live in. And third, even though this is a huge problem, it is not unsolvable. There are smart, structured approaches that are already working. This quote just hits the nail on the head. It reminds us that these inequalities aren't just a fact of life. They are the result of policies and practices, of systems that we created. And what's so powerful about that idea is, if we created the systems that cause the problem, then we absolutely have the power to change them and fix it. So what's the path forward? Well, it's got to be about more than just treating people when they get sick. It has to be about creating the conditions for a healthy life for everyone, right, from the start. It's about building a system that is fair and just, not by accident, but by design. So we'll leave you with this question to think about, because really understanding the problem, truly understanding it, is the first, most vital step before you can take action. The data is crystal clear. The real question now is, what do we all do with this knowledge?